Hello and welcome back to The Art of Parenting. This is your host, Jeanne-Marie Pinnell. And today I have Dawn Winkelmann, and we have been wanting to have this conversation for a long time. Dawn is a feeding expert, and I'm just very excited to hear what advice she has for you, the parents listening. And so, Dawn, thank you so much for making the time to be here with us today.
Thank you so much for having me. I'm so excited to be able to address your community.
Yes, wonderful. Thank you. And as I always like to start, Dawn, what's your definition of the art of parenting?
I love that question. So I really think that when we're looking at parenting as a whole, we're really spending a lot of time as caregivers feeding children. So for me, acquiring that knowledge and then making the best decision that works for your particular family at your particular point in life is really key, because if we can decrease the overwhelm for moms and with parents, then you don't feel so stressed out, because I always tell families, you don't have to get 100% on the test. We just need to pass, right? So I would define the art of parenting as just acquiring that knowledge and then making the best decision that works for your family.
Beautiful. Thank you. And that kind of takes the pressure off of us. So thank you for that. Not getting it 100%. And before we get started in our conversation, I'd love for you to share with our listeners a little bit about your background and how you came to do the work that you're doing today.
Oh, thank you. So yes, everyone, I'm a infant feeding and swallowing specialist with almost 30 years of experience. And I got into the field of speech pathology with the emphasis in feeding and swallowing because of the fact that as a Latina woman, I was raised to want to feed and care and nurture. And I saw so many families being struck by, incidents of choking, and really either if the child overcame that issue, that there was a lot of trauma associated with food and feeding. And so I really wanted to be able to kind of hone in and help that family dynamic and be able to really support feeding development, which, our feeding development for the children helps support speech and feeding, swallowing, play, cognition, social skills, all of that. So I really became fascinated with being able to kind of make mealtime fun, make mealtime successful, make mealtime about milestones and not so much about battles. And then I even fell into product design, and I'm an award-winning product designer for the feeding brand Easy Peasy. So I make feeding products for infants and toddlers and preschoolers to really help parents make mealtime a little bit simpler and really support new parents with education and inspiration on ways that they can overcome risks of choking and make feeding gear a little bit more safe and successful for them.
Wonderful. And I have to take my hat off to you as well, because I was reading a little bit about you before the interview, and that you are a Latina woman with the most patents worldwide. That is pretty amazing.
Yes, thank you.
Yeah. Congratulations on that one.
Oh, thank you so much.
Yeah. And all this to help parents have an easier time feeding their children, because yes, I know feeding can be a lot of stress. And I will kind of specify this is feeding when we come to solid foods, right?
Yes,
because
correct.
Beforehand, we're maybe bottle feeding or breastfeeding. And this is more kind of the introduction to solid food and how to make that as kind of easy as possible. And I would love for us to kind of continue the conversation we kind of started offline before I pressed record. You were telling me that you've been traveling and that you were helping people understand this whole notion of baby-led weaning.
Yes.
And I would love for you to kind of, first of all, maybe explain to maybe listeners who don't know what baby-led weaning is all about, and what is it that you're kind of helping parents and maybe therapists and professionals understand around baby-led weaning?
Yes. So baby-led weaning is an approach to feeding your child, and it's complementary foods that the rest of the family is eating. But the most important thing about the baby-led weaning movement is the fact that we are following baby's lead. There are lots of developmental skills and milestones that babies are supposed to be able to obtain in order to continue their development in other ages and stages. And just giving one example is, a baby being fed by a spoon and the adult, feeding that baby, then the baby is not making their developmental milestones of grabbing a spoon and bringing that to their mouth, which is a 6-month-old milestone. So with us just wanting to feed baby and capture those cute little, picture moments, we're actually kind of delaying baby's development with that. So baby-led weaning is allowing baby to kind of have control and really learn all these skills. And it is a methodology that is research supported, and a lot of communities as well as a lot of different countries weren't aware of this phenomenon and how we can really follow baby's lead and support babies' intuition and how to be able to feed themselves and be able to make these feeding milestones. And so, yes, I was flown out to Japan to be able to start that baby-led weaning movement out there. And so I did presentations to be able to help families kind of learn about this movement and how to really give babies the support and the independence to be able to self-feed. And it was very well received by the families there because there's a cultural shift where a lot of these new parents are wanting to do baby-led weaning, but because of the culture and the generations, it's the grandparents feed the babies. And so there's really a struggle with, why we want to try, a different way of feeding. And I think that's really interesting from a whole culture perspective and everyone's, family dynamics, and adding in culture is being respectful of, where you came from and the foods that you're offering, but also, is trying to at least, have a little mind shift of how can we allow baby to have a little bit more control in this mealtime? How can we support the development of these feeding skills that will eventually support, these movements like hand movements, for example, that's going to help with like scribbling and writing and literacy, and kind of be able to do support that. So I was so excited to be a part of that, country's movement in this area.
Yeah, and to me, that's very kind of positive, forward thinking, if that they're wanting to hear what you have to say and share. That's wonderful. Like, it's opening it up to what children are capable of. And when you were talking, I kind of I had a flashback of when my firstborn was feeding. So I didn't know about this baby-led weaning and all of this, and I would, make puree and feed her. And I remember very well one evening she really refused and she wanted the spoon, right? So I followed her lead, but I remember, like, I don't know, 2 nights later, my husband was taking care of her. I was out, and he got very upset and annoyed with his child who just was refusing. And I was like, well, I think she really wants to feed herself, and we need to follow her lead, right? And to me, and since then I've gone back to school, Montessori, all of this, and I realized, like, it is really about observing our children, right? They let us know what they need. And she, very, very, loudly let us know that I want to feed myself, and they are so capable. So yes, wonderful.
And as a speech pathologist, speech pathologists and occupational therapists are the leaders in the feeding and swallowing movement. We are the medical providers for children who end up having some difficulties with feeding. And so just hearing your story just makes me so happy, because she was communicating with you. She was non-verbally communicating to you her wants and needs and desires, and where she was really trying to say, hey, I can be independent in this. But a lot of times, culturally, we kind of ignore babies' communicative attempts when they're nonverbal. And baby-led weaning really helps to facilitate that baby has a voice, baby has, wants to take that turn. You offer the food, right? You preload that spoon because babies, 6-month-olds aren't really scooping yet. That comes later, but you can, scoop and preload that spoon and then allow baby to pick up that spoon. And it's almost like a conversational turn. You're saying something by scooping up that food and baby saying something by grabbing that spoon and putting it into their mouth. So I love hearing your story that you were really tuned into her wants and needs.
Yes. Thank you for that. And I will also, for the listeners, we do have an episode on actually called Baby-Led Weaning Made Easy with Katie Ferrara, who actually put us in contact. So if you want to know more about baby-led weaning, she talked a lot about that on that episode that I will link in the show notes. But Dawn, I know for you, the fact that you've also created some products to help us, feed our babies and all of that. There's one thing that I really appreciate about the work that you're doing is this idea of an open cup and not using a sippy cup. And I know that I've been personally, I never used a sippy cup, and I've always told parents, ditch the sippy cup. It's, it's marketing. It's so that you won't have to, change your child's clothes or whatever. It makes things easy for you, but it's kind of taking away some very important milestones for our children. So I would love if you could just, dive deep into why not use a sippy cup, and, what are the benefits of really using that open cup with our children?
Yeah, thank you. This is a passion of mine. One of the things that I started seeing, 20 something years ago is families would come to my office and they would come for speech therapy. They'd say, my 12-month-old is not saying any words or not making any sounds. And, I started looking at these young toddlers, 12-month-old, 15-month-olds, and seeing that their speech is delayed, their language is delayed. And I kept finding out that this child was on a sippy cup for extended amounts of time throughout the day, during meal times, during snack times even, and seeing really what that was doing to the mouth. So when we are drinking from a sippy cup, and if any family that's listening has a sippy cup, try to drink out of it. It is making your tongue forcefully come out and suckle. Now that swallowing pattern is very normal for an infant to about a 4 or 5-month-old. But then after that tongue should actually be going to the roof of the mouth, not going in and out of the mouth like we do when we use a sippy cup. So if everyone could just, humor me and swallow your saliva, I'll do it too. So you swallow your saliva and feel your tongue go up to the roof of your mouth. You'll feel your tongue go up there, and then you'll actually feel your tongue kind of have what's called palatal suction. So what that is it's kind of sucking up to the roof of your mouth to your palate and bringing all that liquids down in a nice strong swallow. What sippy cups do is they keep the tongue forward so it can push those teeth out. It can cause dental cavities. It can cause a speech impediment. It can actually move that tongue forward to where children can have some serious oral motor issues. And so, a lot of families don't know that a sippy cup isn't a milestone. We actually go from breast or bottle to an open cup. And most families have no idea that a sippy cup may contribute to speech delays, oral motor delays, swallowing delays, feeding delays. And then there are also safety concerns associated with a sippy cup too. A toddler is rushed to the hospital every 4 hours in the United States because of injuries sustained from the overuse of sippy cups. So not only is this painful, but it also can lead to mealtime behaviors, trust issues, feeding issues, and a lot of what everyone calls picky eating is usually a trauma associated with the use of sippy cups. So developmentally, we want a child to drink from an open cup. It's a milestone at 4 to 6 months of age. A baby is supposed to drink from an open cup held by a caregiver. So we're not expecting that 6-month-old to independently drink from a cup, but the cup that I did design, it's called the Easy Peasy Tiny Cup. You'll see lots of, if you go onto my social at Miss Dawn SLP, you'll see lots of babies, 6-month-old babies drinking independently, with some spillage, of course. But there is, overwhelming pervasive issue that, these children are not swallowing as effectively, they're not eating as effectively. And so it's a great way to be able to kind of skip that sippy cup, use an open cup, advance to a straw cup, and really help your child make those milestones.
Beautiful. Thank you for that, because I know for me, it's, from my kind of background as a Montessori educator, we kind of have that same, what you were saying, either breast or bottle to an open cup. And that we completely forego the sippy cup because it's just teaching the child certain skills, and that if we don't give them that open cup, they will never learn.
Right.
And I didn't realize, when you say speech impediments and picky eating and all that, but it does make sense that it's training your mouth differently. So.
Absolutely. And a lot of families think, mealtime ends up becoming a battle, and not knowing that some of these products can actually contribute to that. So, I have families that will call me and they'll say, I think my baby is a picky eater. And I'm like, well, developmentally, a picky eating phase is normal in the toddler years, but not with our infants. So tell me a little bit about what's happening. And they'll tell me that they're pushing food out and they're not swallowing. And then my next question is, are you using a sippy cup? Because that tongue thrust that's coming out is, encourages that type of swallow pattern where the food is just going to come out of the mouth. And mom feels like the baby is, not liking her food. And so she's feeling rejected, or, they're putting maybe breast milk, hard-earned breast milk into that. And then the child is just kind of thrusting that milk out, thinking that they're supposed to go to a sippy cup. So all of these insecurities, rejection, feeling, negative feelings associated with mealtime is just using a product that is not appropriate for the mouth. So really honing in on those issues and telling, these parents, like, you don't need feeding therapy, take away the sippy cup, use an open cup, call me in 2 weeks. And if you're still having some issues, we'll move on from there. But 80% of those families never call me for therapy, because it was, resolved from just taking away that product.
Wonderful information. And for me, what's fascinating is that, you were talking about just developmental milestones that we need to let our children go through feeding. Like, what fascinates me is the science about the relationship between, these milestones of being able to self-feed and later being able to write or talk properly and all of this. What I would like to know is you talk about this swallowing, and it was my understanding that when children are born, that is one of the things that they are able to do, to be able to suckle and swallow. Like that's the one thing that's myelonized. Is that correct information? And where do these swallowing issues come in? Like, can it be something at birth, or is it because we're not letting these developmental milestones? I don't know if I'm being clear with my question, but I hope you understand.
Yes, completely. And yes, you are right. Babies are born to be able to learn how to suck and swallow, but that swallowing reflex changes as baby gets older. And the position of the tongue and the jaw, and the lips actually move and change. What happens is, for products like a sippy cup, is that it keeps that infant or that toddler, or gosh, I've even seen preschoolers, with a sippy cup in their mouth at that newborn to 4 or 5-month-old swallow pattern. So it's an immature swallow pattern, and we want children to have a mature swallow pattern. So developmentally, around that 5-month, 6-month mark, they're moving their tongue in a different way from anterior, posterior, which is coming in and out of the mouth to kind of suckle from the breast, suckle from the bottle, to tongue elevation. So instead of tongue moving in and out of the mouth, it's elevating to the mouth like you and I swallow. That is what we call in the feeding world a mature swallow pattern. That means the tongue is going up and we're actually using the pressure within the mouth to be able to swallow. So we want babies to actually transition from that immature swallow pattern that's in, infancy, newborn, to a mature swallow pattern. And why we want that so desperately is because that is how we protect our airway. So if we continue with this tongue in and out swallow pattern, then we don't know how to protect our airway. And this is where it can really hinder feeding, because then what happens is that babies will start to refuse any foods that they can't do this easy tongue pattern. So as adults, if we're chewing steak and it's something that we really have to chew, we are moving our tongue from side to side inside of the mouth to actually help with that chewing. And then we're moving our tongue up to the roof of the mouth in order to have a really good swallow, because we want to make sure that we don't choke. If we have a child that is not doing that pattern, then they're swallowing food whole. So they're taking that food, they're putting it into their mouth, and they're just kind of suckling it back. And that is where we get into this risk of having some choking issues. So we can do this tongue pattern. We can teach babies to be able to do this tongue pattern even before we start solids. So if you have a baby that's, 4 months of age, 5 months of age, you can teach babies to be able to have this tongue elevation. It's called a pre-feeding skill. And these are skills that we really want to be able to teach our babies. They're essential movements for swallowing saliva, for swallowing liquids, for swallowing foods, because we want that tongue to lift to that roof of the mouth, create that suction, and then initiate that swallow. And we can do that with the teethers that we give to babies. We can do that in order to prepare babies for eating and drinking. I tell families all the time that drooling is really not normal. What a drooling baby shows me is that that baby has yet to learn how to bring that tongue up to the mouth in order to swallow their saliva. We want that mature swallow pattern, by that kind of 5-month mark, so that when they transition to solids at 6 months, then, they already know what they're supposed to do. They're not spitting out food. They're actually knowing how to be able to swallow that. I designed a product for this specifically. It's called the Oral Development Tools, and they're a set of 3 tools that really focus on babies' development. And that is for tongue elevation, tongue lateralization, so that tongue going from side to side, and working on lip closure, closing the lips so that drooling doesn't occur, closing the lips so that food doesn't come out of the mouth, closing the lips so that the lips can go tightly around a cup or tightly around a spoon, so they actually swallow and learn how to be able to swallow all of the foods and liquids that we are so excited to try with them.
Right. And with this, like with children that have had maybe a tongue tie or a lip tie, would this, I guess, affect that whole milestone also to be able to move around their tongue like you're describing?
Yes, a lot of the times, some of the babies that come to me, parents are like, starting solids has been really, really rough. And we'll do an oral assessment. And I work really closely with pediatric dentists and functional dentists to really look at that. Sometimes, tethered oral tissue, we can kind of get past the restriction of that movement with breastfeeding or bottle feeding. And we don't really see that that is really causing an issue until we start solids. So we can kind of relook at that tethered oral tissue and reassess and see, beforehand, breastfeeding was doing great, but now that we're starting solids, the baby's really having a hard time protecting their airway, really having a hard time elevating that tongue to the roof of the mouth in order to have a good swallow. And so we can reevaluate that. What I love about, these pre-feeding tools is that we can we can really look at that function of the tongue prior to starting solids. So one of the tools that I designed is called a loop tool, and it allows baby to be able to chew on it, but also allows a tongue to come up through the hole to practice that tongue elevation. So I tell families, look, see if your baby's tongue is coming through that hole as they're kind of chewing on it. If it's not, then that might be something that you might want to, go to a pediatric dentist, have them kind of look and see, is there any restriction of that tongue, so that we can kind of have a plan when you start solids, so that solids can be fun and exciting and not, scary, and parents are afraid of, possible choking issues related to that. So we really want to look at that tongue. We want to look at those lips. We want to make sure that baby's able to close their lips, breathe through their nose, and be able to swallow their saliva. A lot of the babies I see are just drooling and, their nose is congested, and we're worried about airway issues. And, that's not putting us up for success with starting solids. If we've, got all this congestion and baby's not really able to manage their own saliva, then they're really going to have a hard time managing some solid foods. So being able to kind of prepare parents and, have this information so they kind of know what to look for in order to be able to really, start solids out successfully, and really for parents to know that, hey, it's 99% of the time, it's not the food that you're serving. It's not the way that you're serving it. It just, baby might not be ready. And we want to look for some of these pre-feeding movements to make sure that baby can, really protect their airway and you guys have a successful start.
Yeah. And what you're saying, also what I'm hearing, is to be aware ourselves, like how we're eating. So just to be very mindful of, how our tongue moves in our mouth and how we're swallowing and all that, so that we can observe our children as well. Like, I don't want it to sound like to be alarmist or whatever, but it's just like being mindful and
Yes.
being aware of, what it is that we do and how can we help our child do the same thing, basically.
Yes, in my starting solids classes, I have parents like eat a cracker, they put it in their mouth, and then I say, don't lift your tongue up to the roof of your mouth. Go in and out. Really mash that cracker like into the front of your mouth. And parents are like, oh my gosh, I get it. So I
Uh-huh.
would encourage any of you who's listening, like try that, like put your tongue in and out like you would, be, instead of, putting it up to the roof of your mouth, and see, how differently your body kind of responds to it. Like when I watch parents, do this fun, practical joke with me with feeding, I see their necks really moving, their shoulders are really moving, they're kind of rocking with this. They are really struggling. And I'm like, those are the same movements that I observe when I'm working with families. I'll see that the baby is rocking back and forth. They're really struggling. They're using their shoulders to be able to try to manage this food. And those are all signs that baby's really struggling in the mouth, that the tongue or the lips, something, the jaw is making it difficult for babies. And so these milestones that I'm talking about, and helping parents be, really aware of this, is just to kind of set the stage so that you feel like you are confident starting, solids with your baby, and your baby feels like they have the independence and abilities to be able to do it.
Right, right. And what is your take on pacifiers for babies? Does that affect the whole feeding milestones?
Yes, actually it does. There's a lot of speech pathologists and oral myologists who really don't promote the use of pacifiers, and I'm not that person. I think pacifiers can be a great tool for your baby from infancy, from a newborn to 6 months of age. If your baby wants to have that calming and have that rhythmic movement to be able to help, keep them regulated, keep them calm, then be mindful of that. Like we want to allow baby to have that encouragement to actually work those mouth muscles. However, it's the overuse of pacifiers that I really try to educate my families is that we From newborn to 6 months of age, we're allowing babies to kind of comfort themselves orally with a pacifier. But at 6 months of age, most babies are starting solids. And so we want to teach that comfort, that movement is actually chewing on food, munching on a spoon, like drinking from an open cup. They're getting their sensory stimulation, that comfort, that soothing from eating. And so at 6 months of age, we're kind of tossing that pacifier and allowing baby to really learn those motor and sensory experiences through food. So we're going to offer, different colors and textures and temperatures in order to allow baby to have these exciting mouth movements. Then we don't need that pacifier. And then what we know with that too is that overextended use of pacifiers can, again, cause oral motor issues, speech issues. It can, increase the palate to be more narrow. And so there can be a lot of other issues that can come from the overuse of pacifiers. But I encourage parents, if you're using a pacifier and you want to use a pacifier, go for it. But around that 6-month mark, we want to get rid of it. And it's much easier to get rid of a pacifier at the 6-month mark with a baby than it is for a toddler that's going to fight you on that.
Definitely. And for me, it's like you say, if your child needs one, sure, but it's not like, it doesn't have to be on your baby registry, for example. Like
Yes.
for me, it's not a, something that all babies have. I know if I had 2 children, neither of them, ever wanted a pacifier or, I think I offered it to my second at one point and was totally rejected very quickly. So, to be like okay with your child not wanting one also. And I like the fact that you say, around 6 months, like that's enough, because it's true. I have seen, preschoolers who have difficulties because they still want their pacifier or things like that. And that's not doing them service at all.
Absolutely.
Yeah, thank you. And so just one more thing about, feeding and so forth. I know at least parents that, I work with, they often, talk about this notion of picky eating and that, my child doesn't want this or that. So I have, an opinion around that, and that is to, especially for our toddlers and our preschoolers, is I really like to involve them in food preparation, in food choices and all that. And I truly believe that when they are involved, they have a better a tendency to want to eat what they prepared. What is your take, or what is your advice to parents who might be struggling with a child, quote unquote, who's a picky eater?
It's so interesting how so much misinformation is given out there regarding picky eating. And I see, on social media, and prevent picky eating and stop
Impossible.
picky eating before it starts. And it's just like, that is such baloney. Picky eating is a natural developmental stage. If you are being brainwashed that if you buy this program or this product or whatever, then your child won't have picky eating, you are talking about your child not going through a very important developmental stage. Every single child goes through a picky eating phase. That is a natural feeding and swallowing phase that every child should go through. The problem is that it should last weeks, maybe months.
Okay.
But not, definitely not a quarter, definitely not a year. And so it is not something that we prevent. It's a stage. It's like we're not preventing the stage of crawling. We're not preventing the stage of walking, right? Because kids can fall and hurt themselves, right? We don't prevent that stage. But what we do want to do during that time is that how it gets longer is not having consistency, not having routine. And that can increase the length. So if you're offering foods to your child and all of a sudden they wake up one day and they're like, I hate blackberries, right? And if you're going through it, you know what I'm talking about. And then the next day you give blackberries and they hate it again. It is a natural progression for your child to be going through that and to really be unsure about that food. But if we never offer that food again, then that child will never overcome that. So what you were saying, yes, have them, be involved. Maybe we're going to take those blackberries and we're going to put them, involved, and they're going to throw some of those blackberries in a smoothie, and we're going to offer that smoothie from an open cup, or we're going to introduce that food in a different way. So maybe we're going to take blackberries, we're going to mash it, and we're going to put it onto a cracker and make our own little jelly. How fun is that? Maybe we're going to kind of delay the next meal by 30 minutes or an hour before they become hangry, and then offer that blackberry again. We're going to change the temperature of that. Maybe we're going to make the blackberries really cold, and so we're going to put them in the freezer for a little bit and then offer them in a different way. Maybe we're going to take the blackberries and mash them up and put them into a popsicle mold and offer a popsicle. Maybe we're going to make a dip out of it. We're going to keep offering that food in different ways. And this is not saying you have to be a Pinterest parent. Like, this is just, taking the blackberries out of the refrigerator, put them in the freezer for, 15 minutes, right? It's just allowing a little bit of novelty to help the child kind of overcome and feel safe with that food again. And two things that a child is doing during that picky eating phase is they're trying to figure out if that food is still safe for them, and they're trying to figure out if that feeder is still safe for them. So as they're learning about that food again, remember what's happening during this time. Your child's mouth is getting bigger, their tongue's getting longer and thicker, their nasal cavity and oral cavity are separating a little bit more, their throat muscles are changing. They're going through a lot of different developmental stages. Their respiratory patterns are changing. And so there's a lot of, teeth are coming in, more saliva is being produced. So that blackberry may be very difficult for them to chew. Now they have teeth maybe, and that blackberry is getting stuck in between their teeth and they don't like that feeling. And so it's not that they don't like the blackberry. It's just that they don't like that oral motor movement, that they're not able to get their tongue and get that seed out. So there's lots of different reasons. But if we take away that food, then we take away that experience for them to learn about that food. And if we say something negative about that food, so we say, oh no, Johnny's going through the picky eating phase, and we start labeling the child, then the child tends to maybe not feel as safe with that caregiver. So it's really important that we're supporting and having parents be aware and mindful that, they're trying to figure out if they still are safe with that food, and they're trying to still figure out if they're safe with that caregiver or that environment. So just something to ponder during that phase.
Yes. Thank you for that. And when you say it's a normal stage, is there an age range as to when to more or less expect that?
Yeah, it tends to happen between 13 months of age and 3 years.
Okay.
And so, you're thinking you're rocking stuff out. You're like rocking out that first birthday. And then the next month, they're like, what happened? And so a lot of families are like, all of a sudden, my child turned into a picky eater. Please know that this is a phase. So I try to educate families in my classes and say, this is a phase. This is not who your child is.
Right.
This is a phase. Right? So it's the way that everyone, including the child, responds to that phase, right? So just like there's a phase of riding a bike, right? It's how everyone responds to that. If your child falls off of the bike, right? And then you say, oh, we're never putting, the child back on the bike, right? They're going to be fearful of the bike. So if we all respond in a negative way, we just need to be mindful of like what we're saying, how we're saying it, what we're doing. Are we not offering that food again? What is our feelings surrounding that? Are we not wanting to offer that food because we feel that we're being rejected?
Mm-hmm.
Right?
Yes.
So just being able to kind of, think outside of that box of what's really happening to your child's development. I try to encourage parents that, when it comes to feeding, everyone forgets about the developmental skills that are happening, but anything else is okay. If we stopped a child from crawling and walking because they're going to fall down, then the child will never be ambulatory. So we have to think about that too. Like meal times are going to be messy because the child is learning about food. Meal times, they're going to be a picky eating phase because their child is learning about that food with a different stage in their mouth. Their mouth is developing. So that food that the child ate at 6 months of age when the child had no teeth and the tongue is very small is a very easy food as compared to, toddler years with lots of teeth and coming in and tooth pain and having those seeds get stuck in the mouth. The same food, but it's a very different mouth. So we can kind of look at that different.
Yeah. And thank you, because all you're saying is very reassuring, I think, to parents. Like, it's a phase, and of course, don't let it go on for too long, but this is just normal, natural behavior, and they're just testing things out. And I have young adults now, but as you're talking, I'm like remembering things of like, oh yeah, I remember that phase. And they both eat to their heart's content today, but it's true, we all go through that. And I was labeled a picky eater. I have made up for it since, but it's just, so thank you. It was just a phase. And but I know that it worries parents. I mean, I remember my mother being worried, she was like, absolutely. And I think there's also maybe an evolution as to feeding and our responsibility in feeding.
Yes.
I know for me growing up, it was, you had to finish everything that was on your plate,
Yes.
whether you were hungry or not. And that was, not something that I wanted to do with my own children, and so forth. And now we know, so much about that, and just, eating disorders that can stem from that, and all of that. So I think we've evolved, like all things parenting, evolved quite a bit. So thank you for all the work and the wisdom that you're putting out in the world. Dawn, as we wrap up, I would love if you have maybe some words of wisdom for maybe those who aren't yet parents, who are maybe expecting, or who have infants, and who are kind of maybe anticipating this whole, baby-led weaning that's around the corner, and so forth. Like, what would be some words of wisdom that you would have for our listeners?
I would like them to just know that feeding is frustrating. Absolutely. You're going to have frustrating days, but just know that if you establish a routine, if you become more familiar about the developmental stages your child is going through, it's going to give you that light at the end of the tunnel. It's going to feel not so heavy in the moment if you can just kind of know that, repetition is going to really make this routine of mealtime easier for you, easier for your baby, and easier for your baby to be able to eat with other caregivers, which is really important. And I specifically want to say that to the moms out there, is that the moms that I work with feel so isolated. They feel like they can't leave their baby because, baby won't eat for their partner, baby won't eat for grandma, baby won't eat at the daycare. And they feel so isolated that if you kind of establish those routines, you're able to have that repetition, that it is going to get easier. And if you're struggling along the way, there's feeding therapists that are speech pathologists or occupational therapists that are the licensed providers to be able to help you with that. And I do virtual parent coaching to be able to help facilitate that if they need extra assistance. Or I've been there, online to be able to help parents as they're starting their first foods, to be able to say, oh, is this right? How am I doing this? And I'm like, yeah, you've got it. So sometimes if you just need that cheerleader, maybe it's a family member that can kind of help you, or maybe it's a therapist like myself to just know that, that feeding journey is something that you really want to enjoy. And kind of, as you have the frustrating moments of food on the floor, or, baby throwing up after eating, that there is development that happened, and there is a bond there that your child's going to remember for the rest of their lives.
Beautiful. Thank you so much, Dawn. This has been extremely helpful and a lot of wonderful information. So thank you so much for all your wisdom today.
Oh, thank you so much again for having me.